Before we look at the compensation bit of it, Doctor, when you're doing these necessary tests to see if a mother is fit, what kind of test do you look at? Do you look for? For example, if I'm the one going to carry this baby. Yes, what is that you check?
The requirements for somebody to be a surrogate mother, there are about 3 dimensions.
Okay.
Yes. Of course, willingness is there, but from the medical perspective, the person should have a healthy reproductive system. So the person's reproductive system should be healthy and functioning well. Both from our assessment, but also in terms of the fact that they have given birth before. Because there are some tests, there are some conditions which affect people's fertility, which are not amenable, which are not detectable by the tests we have for now. So in science for now, so we have to be sure that there's a proof of fertility. So that a person should have given birth once, or twice, and the last pregnancy should not be more than 5 years before. Yes, so that's a reliable proof of fertility. That's what our practice is really. Yeah, so that should be, there should be reproductive health. I mean, reproductively, the person should be healthy. Then, in the general state of health, they should also be healthy. They should not be having an underlying conditions like HIV. They should not be having diabetes. They should not be having heart conditions, things which can jeopardize the health of the pregnancy. And also their own health, especially that the pregnancy is also a stress.
It becomes a high risk.
Yes, but also very important, the person should also be psychologically and emotionally healthy.
And stable.
Stable, because pregnancy comes with its challenges, even if it's your own pregnancy. Now imagine if it is somebody else's pregnancy. That is more challenge and unpredictability. It may be very unpredictable. So such a person, at least from the beginning, should be healthy. Yeah, this is from the medical state of mind. And we need to be sure that there is no hidden motive for this offer to be a surrogate. Yeah, the only thing we can tolerate is maybe the need for some money here and there, some compensation, though it's not much. But if the reason for somebody offering to be a surrogate is not very clear, we are usually very skeptical about that, because there are many things we still don't know, and you know, things can happen. Yeah, so that is also, we also observe that. But also in terms of age, we usually don't take people who are beyond 30 years.
I wanted to ask about age.
Yes,
you don't take people beyond
30 years of age. Yes, because we know beyond from 35 and above, the risk of complications during pregnancy increases. So if you have the option of avoiding them by working with ages below that, for us we pushed it lower to 30. Because partly because it's very hard to verify people's ages, so you need the margin, and in most cases people underreport their ages. Yes. And then somebody should not be below 20 years.
Below 20. Yes. 25 is okay?
25 is okay. So between 20 and 30 is our operational range.
How are these people compensated, doctor? Or it's just an act of goodwill?
Yeah, so well, compensation first of all, for the surrogate program, it varies from country to country. Now, if I talk about what we have here in the country,
in Uganda.
Yeah. Now, ideally, this is a program which should have a guideline, which should have a law in place, which should have regulatory process systems in place. Unfortunately, we still don't have that. We don't still have that. But as a unit, what we depend on, thank God we are Christians, and we believe that, so we believe in ethical principles and fairness and all these things. Yeah, so that, using that, and also we refer to other laws. For example, the European Society, the European Society for Human Reproduction and Embryology has some guidelines which we refer to extensively. We also have some legal documents which we refer to, used in the UK. Yeah, so we get guided by some of those things, and we apply our cultural values. But in terms of compensation, we in our unit, we don't give like commercial values for these things. So we need to ensure that people are actually offering to help, but they need to be compensated for the inconveniences.
And their time.
Yes, their time. So they should not be spending their own money for transport.
True.
They should not
medical care.
Medical care that should be catered for. And then the losses which they make because of these commitments will be compensated.
Especially if they have other children and families.